Other key takeaways that I just want to share that I notice or when I reflect now from my past during my undergraduate studies is the different activities I was in involvement with. And outside of the drop-in center, I was also part of the IT department. And I know this probably is probably a little bit left, right? But to me, I'm going to say it's not because having a basic understanding on technology in general is beyond helpful, especially given this new AI period. But having the opportunity to serve in the capacity when it comes to computer needs and understanding, like, what are some things that kind of were troubling for different people, whether they were professors or students, it kind of put in my mind, like, okay, we can find ways to make things easier for people, right? Something as simple as that. And I think that's when my public health hat started turning, right? Because you identify what the problem is, right? And then you try to find ways to address it. But you also find different ways to maximize on your strength. So the more I learned and was able to help others, it helped me. And it gave me this passion to also want to get into health communications, right? How do we communicate with the public in a way that they'll be receptive to it, right? Which opened the doors for me to have other opportunities, such as the opportunity when I was able to be a marketing consultant for innovation to impact at Yale, right? I kind of took what I learned, right, with the things I learned when it comes to community-based customer service appeal, and then trying to transfer it there. Or even in my current role, I know I serve as a public health consultant, but in my role at Yale, I'm the associate director of health communication. So it's like it's even within the title, but you're trying to understand how to make things more mainstream, right? But that baseline was very, very helpful for myself. Another thing I want to add was that I ended up becoming a resident assistant, right? And even in that space, because I actually started my undergraduate career as a commuter. And a lot of people have this misconception like being a commuter, you're missing out, or because you're not standing. But I feel like you have to move with more intention, right? So for myself, I found different clubs to be a part of. I mentioned to you I was working in IT. I mentioned to you that I was a part of the drop-in center, but it also gave me opportunity to understand what the culture and the community of the school I was in was like, right? When you're creating these programs for your residents, right? What will be most appealing to them? What will be most beneficial? Flu season's around the corner. I know I have this passion for health, but how do we get people's buy-in to know to wash their hands or know to maybe get vaccinated if they still choose to, or get tested, right? What to identify? And it kind of just spiraled from there.
I, I'm grateful that you also added the part around the IT, which definitely isn't something like someone would traditionally think about. But there are so many ways that we gain skills and experiences from things that are not quote unquote ideal, but are still important to our journey. So I appreciate you sharing that. And after your undergrad, you went on to pursue an MPH in urban public health at Rutgers School of Public Health. So maybe tell us more about that process of thinking about going for a master's degree and then more about like maybe the master's in public health specifically.
So for my own personal journey after undergrad, when I applied for master's programs, Rutgers actually wasn't one of the schools that accepted me right away. I've got accepted at schools like BU. I applied for like programs in Seton Hall. I even applied to local university, Kane, just to for those who maybe are Jersey based. But Rutgers didn't accept me for my MPH. Instead, I was given the opportunity to do a certificate program. And for those who probably ever received any denials, right? We'll just say that the door was just not open for you at that time, but I was so grateful for it because I did not really understand or know what I was setting myself up for. Like having a master's was like something I never even thought of, especially coming from a family where even having a high school diploma, let alone a bachelor's degree, wasn't something that I saw, and I had to navigate the spaces that I was in. And I'm just very grateful for different mentorship that I had that opened the door for me to even consider getting a master's. But going to Rutgers, I did the certificate program, and that actually gave me an idea to kind of take the basic core classes or fundamental classes for my master's. And then I was able to transition into my specific concentration, which is urban public health. And for anyone who's on this call or who's listening or even watching, Sometimes we don't always go in a path or the direction that we feel like we will, right? It's like that we just want things to be a certain way, but it's okay when it's not, right? Because we end up getting more opportunities and more blessings in the process. And me getting my certificate, I was very active with my graduate studies. I ended up being the president of SGA. Didn't even know master's programs had those opportunities. I was really hands on. We have a program called Voices. So it's basically a program for volunteering. And I was introduced to maternal and child health in the capacity of Are You Match? I believe that was the program called, and I later ended up doing a fellowship. But from that certificate, I could have been upset or I could have been angry, like, I didn't get to the master's program, I'm not going to go. But instead, I took it for what it was and actually opened the door for other opportunities for me to pursue my study. And then I graduated. So, and I'm very grateful for that as well.
Shout out to you and appreciate the vulnerability in this story. And yeah, because not every door is going to open the way that you think it's going to open. And it is about persevering and continuing to build on those lessons and continuing to just, choose you in whatever that journey looks like. So I'm glad that you were able to do that. And I guess that's also a shout out to like using certificates as a way to get into Masters of Public Health program, because I definitely have heard that before. So I think I could research more into that. But and I think it is also because a master's program in itself is a big investment. So maybe even just thinking about, okay, I could do this certificate, it's going to help me be more competitive, and then if I do want to transition full time, then I can do that. But I appreciate those insights.